in a number of hospitals across the country that are public hospitals. There are consultants who are currently setting up private companies and then redirecting some of the patients who are on the waiting lists and backlogs to their own private companies. In one situation, it's alleged that the consultant who is in charge of rostering in that public company is redirecting some of the work so that more work goes to that private company. And I think this is absolutely shocking. We put in a parliamentary question to the Minister for Health in relation to this just recently, and that parliamentary question actually corroborated the information that we've received. It shows that less than 12 months ago there was an internal audit done within 3 hospitals, UHL being one of them. In UHL they found that 14.2 million euros of procurement happened outside of proper procurement rules. It wasn't in an open procurement setting, which is quite incredible. And it also found of 3 occasions where there are staff within the hospitals who are setting up private companies to then deal with work that should be dealt with in a public fashion. Now, we know that the INMO are having their conference today, and this feeds into some of the dysfunction that's happening within the health service currently. There are 800 consultants posts that are vacant currently throughout the state. There is an enormous amount of work coming at public hospitals. I know one Midland hospital where there's a backlog of 960 biopsies, which is quite incredible. And in that type of situation, these are diagnoses that are being delayed, these are treatments that are being delayed, and these are worse outcomes for patients. And we need a government, first of all, to make sure we do not have a situation where there could be a conflict of interest between consultants who are working on the public pay in redirecting business to the private company that they're involved in. And secondly, we need to make sure that there's proper pay terms and conditions put into our hospitals' staff so that we can recruit the necessary staff to get through the backlogs that are there. So there's an issue that we'll be raising in the Dáil today.